Notice the common carotid artery as it lies posterior to the lobe of the thyroid gland. This is the lower pole of the thyroid gland. It reaches down to the level of the sixth tracheal ring, a position which is very near to the sternoclavicular joint. This is the prevertebral fascia, which covers the prevertebral muscles. It lies behind the phalanx and extends laterally to cover the muscles in the floor of the posterior triangle. This is the insertion of the scalenus anterior muscle into the scalene tubercle of the first rib. It divides the subclavian artery into three parts. The first part medial to it, the second part behind it, and the third part lateral to it. This is the first part of the subclavian artery. It arises behind the sternoclavicular joint on the right side. But on the left side it arises separately from the arch of the aorta. It gives off three branches, namely the internal thoracic artery, the vertebral artery, and the thyrocervical trunk. This is the internal thoracic artery. It descends into the chest behind the first costal cartilage. Note that the phrenic nerve crosses this artery from lateral to medial as it enters the chest. This is the first part of the vertebral artery. It ascends in the triangle made by the scalenus anterior and longus colli muscles to enter the foramen transversarium of the sixth cervical vertebra. Its second part runs inside the foramina transversaria, while its third part will be seen in the suboccipital triangle in the back of the neck. This is the thyrocervical trunk, just medial to the scalenus anterior muscle. It divides into three branches: the inferior thyroid, the transverse cervical, and the suprascapular arteries. In this body, the suprascapular artery does not arise from the first part of the subclavian artery, but from its third part. It joins the suprascapular nerve, and the two together run behind the clavicle. The clavicle is removed. The transverse cervical and suprascapular arteries join the anastomosis around the scapula. This is the transverse cervical artery. It runs laterally, crossing the scalenus anterior muscle to enter the posterior triangle. This is the inferior thyroid artery. It ascends to the thyroid gland. This is the second part of the subclavian artery, which lies behind the scalenus anterior muscle. The second part of the artery gives off a short costocervical trunk, which divides into two branches: the superior intercostal artery and the deep cervical artery. This is the superior intercostal artery. It arches over the apex of the lung to descend in front of the neck of the first rib and gives off the first posterior intercostal arteries. This is the deep cervical artery. It passes backwards to reach the back of the neck and thereafter ascends to anastomose with the descending branch of the occipital artery. This is the third part of the subclavian artery. Usually it has no branches. It is present in the posterior triangle together with the three trunks of the brachial plexus. These structures appear between the scalenus anterior in front and the scalenus medius behind. The subclavian artery continues at the outer border of the first rib as the axillary artery. These are the roots of the brachial plexus. They lie behind the scalenus anterior. The anterior primary rami of the fifth and sixth cervical nerves form the upper trunk. The seventh forms the middle trunk, while the eighth cervical and first thoracic unite to form the lower trunk. This is the suprascapular nerve arising from the upper trunk. It runs lateral to the upper trunk and is joined by the suprascapular artery. This is the scalenus medius muscle behind the trunks of the brachial plexus. It is closely related to the roots of origin of the long thoracic nerve or nerve to serratus anterior muscle, which arises from the fifth, sixth, and seventh cervical nerve roots of the brachial plexus. Compare this with the phrenic nerve, which descends on the surface of the scalenus anterior. It arises from the third, fourth, and fifth cervical roots. Before leaving the root of the neck,